Hello, and welcome to another segment in our series, brought to you through the partnership between InSync and AIHE. Our goal is to provide healthcare professionals with the tools and knowledge to navigate complex issues with confidence. Today, we have Dr. Prada and Dr. Chandrasiri lined up to share their experience. Let's get started. In Queensland, we have Ryan's Rule, which was developed in response to the tragic death of Ryan Saunders, who died in 2007 from an undiagnosed streptococcal infection, which led to toxic shock syndrome. We've also seen the tragic death of children such as Ashwarya Aswath in WA in 2021 and Joe Massa in New South Wales in 2024. We have similar incidents coming out of the NHS, and we keep hearing that lessons will be learned. But the same tragedies continue. What is it going to take for us to learn from each other and listen to each other in these types of situations?
I might start off, Lewis, if you don't mind, with this one. For me, again, this is about really coordination of healthcare, and I think it's a problem that comes down to individual organizations. Because if you look at current organizations, we have compliance requirements and regulation around doing RCAs and other investigations, but we're still so immature about sharing those lessons even between our own departments or between our own hospitals of the One Health Service. So I think when you translate that on a national scale, that's what we're seeing. States are not sharing the lessons that they've learned with each other. The public health sector is not sharing lessons with the private and vice versa. So I think just like we've got APRA as a national regulatory body, and just like we've got the national standards across Australia, sharing of lessons from key RCAs and key clinical incidents should absolutely be coordinated and on a national scale. How we get there is obviously the challenge, but if that is the intention that we start off with, I think that would be the first step in the process.
Yes, no, I completely agree with you, Sydney. I think the tragedy in the case of the children in Australia who've been lost and harmed because of failure to identify and escalate clinical deterioration and failure to listen to parents is something that, as healthcare professionals, we should just not accept occurring anymore. The fact that we don't have a national, equally applied approach to that in terms of what parents can expect when they take their children to hospital is really indicative of the problem that you've identified in lack of sharing of learnings. This should become part of a nationally agreed process that all learnings from sentinel events and significant incidents are required to be shared across the country. And in particular cases, we need to involve our consumers, our patients more directly. Parents should know they should expect how they can escalate their concerns no matter which part of the healthcare system they interact with. No matter what hospital they go to across our country, they should expect to know that they will be heard if they're worried, and they expect to have their children looked after if they deteriorate. And for that to happen, we need a nationally consistent approach. And I do recommend that that is done by one of the agencies that exists now and are empowered to do so. And when we are surveyed for our national standards accreditation, we shouldn't just be looked at as in terms of whether we comply, but to see the actual responses to these changes are implemented, followed up and evaluated, with the consumer's participation being critical.
And the other thing also, Lois, is that it comes back to the principle of equality as well, doesn't it?
Mm.
Equality in access to healthcare, no matter where you live, which jurisdiction, which geographical area, and also the consistency of that healthcare. It should be consistent across the country. You'd think that is the basic principle.
And just with regards to that, the fact that each state is relearning from a tragedy that has already been well established how to respond to it. That to me is indicative of the fracturing of healthcare, and the consumer and the patients are the innocent parties here, because I'm sure if we went to the consumers and said what you would expect, they would say, why isn't there a one approach for this whole nation to look after, in this case, our children?
Thank you, Dr. Prada and Dr. Chandrasiri, for sharing your expertise. It's always valuable to hear about your experiences and also your practical advice. We hope that this session has given you some useful takeaways, so stay with us for the next discussion.